Hello everyone. I hope all of you are doing well. And this is Dr. Zainab, a family medicine physician with you. I'm currently doing my residency in Kuwait, and this residency is going to provide me with MRCGP International. And since I have talked about MRCGP International before in some of my videos talking about the exam and its components and the eligibility criteria, many of you have asked me since then on how to take this exam, like how to prepare for this exam. So I thought of making a brief video and clarify about this. So basically, the exam itself has the two major components, which is the applied knowledge test, that is the MCQ. And the second component is the clinical skill assessment, which is basically an OSCE. Now, the thing is that the curriculum of the MRCGP international exam is specific to each country. Like, it is not the same in every country. It will be different for MRCGP South Asia, it will be different for Kuwait, it will be different from the Cyprus and Malta, in all the countries that actually provide MRCGP international. For this reason, I cannot actually specify that how are you going to prepare for it if you're not taking it in from Kuwait. So, but ideally, the two main components which I mentioned, the applied knowledge test, the MCQs, and the OSCE are the two major components. The MCQs, again, the number of the MCQs might differ as well. For example, there might be 200 MCQs, but I've read that recently the MCQs have been reduced to 160 from October 2025. When it comes to the OSCE, there are 12 stations. And in those 12 stations, you will see that there are 12 different cases. And either there'll be a real patient or a dummy or a professional role player will be sitting there. And you basically have to do the consultation like you do in the clinic, starting from the history until the management. There will be different stations. You'll have, in some stations, you'll have to examine a patient. In some stations, you might need to perform a procedure. In some, it will be just the consultation skills. So this is how the 12 stations are. Generally, in terms of preparation, when it comes to MCQ, I think generally for everyone, one of the best resource for MCQs is passmedicine.com. You subscribe to the AKT, the Applied Knowledge Test part of that Pass Medicine. Like when you will go to the passmedicine.com, you'll see there'll be different components. Like, do you want to subscribe for AKT or MRCP or PLAB? So you just click on the AKT part and you subscribe to that. And I think there are like 4,000 to 5,000 MCQs there, and they will definitely help you to prepare for the MCQ part. The second thing, for the theory, generally you should know the theory as well. So for all the GPs out there, I always tell them to get this book, the Oxford Handbook of General Practice. As it mentions, it's a lifeline for the GPs, and it is, to be honest. It has everything that you really need to know as a GP, all the cases, all the problems, all the diseases that we see in our clinical practice and how to approach them. It is beautifully outlined in this book. Okay, and about the Pass Medicine part, I forgot to mention that it doesn't just help you with the MCQ bit. Pass Medicine has a very good explanation of each and every MCQ that you will answer, as well as they have a separate portion of notes. And in those notes, they have a full-fledged theory of all the topics. And there are all the recent guidelines, specifically the UK NICE guidelines of all the diseases like diabetes, hypertension, and asthma, and all of that stuff. So it is also good for theory, by the way, not just for the MCQs. Now comes the OSCE part. Now for the OSCE, as I mentioned, that when you will apply for the MRCGP international exam, so wherever you're applying from, they're going to help you with the preparation of the OSCE as well. For example, I'm doing my MRCGP international from a postgraduate training program in Kuwait. So that program itself provides us with resources, workshops, hands-on training, crash courses, and all those courses, they help us prepare to prepare for the OSCE. So similarly, when you apply for the MRCGP International somewhere else like South Asia, if you'll go through their website when you apply, they will also provide you with different online links and books and sample questions and the hands-on training courses for the preparation of the OSCE as well. So yeah, so that's so for that you have to follow the body that you're applying through. Okay, and one more thing is the examination. Examinations are very important for the exam because one or more than one stations will be about examining the patient. So as a GP, you should know all the examinations from head to toe, which includes neurological examination, cardiac, respiratory, abdominal, breast exam, all the musculoskeletal examinations, thyroid, and all of that stuff. So for that, you can either use the Macroid clinical examination book, or you can watch the Geeky Medics videos on YouTube. They're very helpful. So yeah, these are the two main resources for the examination part. And yeah, that's basically it. I hope that this video was useful, and I tried to summarize the general preparatory resources for all the GPs out there who are preparing to take this MRCGP international exam. And yeah, good luck. Bye.